Thank you. We'll just wait another minute or two. We're just getting our Facebook live stream going.
Recording in progress.
Good afternoon, everyone. Glad to have you with us today. We are here with Dr. Jeff Duchin to do our media briefing on COVID-19. And just a reminder for media, since it's been a little bit, if you will take Q&A after Dr. Duchin has some remarks, and you can use the raise your hand function to put raise your hand, and then we'll be able to call on folks for some questions. So with that, I'm going to turn it directly over to Dr. Duchin.
Thank you, Sharon, and thanks everyone for joining today. It has been a bit since we've spoken, and I hope you'll forgive me for my opening comments being a little bit longer than usual. Lots happened since we last spoke. I'll begin with our recent epidemiology and then move into an Omicron update, speak a bit about vaccine and boosters, and some information about rapid tests as well. So beginning with our epi update, as of yesterday in King County, we're reporting over 177,000 cases, 8,915 hospitalizations, and 2,127 deaths from COVID-19 in King County. Over the last 7 days, we've seen an average of 284 cases per day, representing a decrease of about 9% from December 3rd, after a 2-week post-Thanksgiving increase. However, it's not clear whether this decrease will be sustained, and you'll understand why as we go on in the briefing. The 7-day incidence rate is currently 88 per 100,000, still classified as a substantial level of transmission, and comparable to where we were a month ago in mid-November. The 7-day incidence is highest at this time among 5 to 17-year-olds, followed by 25 to 34-year-olds. And as has been the case, the vast majority of our COVID-19 cases, hospitalizations, and deaths continue to be among people who are unvaccinated. Since January 17th, 2021, 79% of cases, 89% of hospitalizations, and 86% of deaths among people who are not fully vaccinated. Over the past 7 days, 53 King County residents were hospitalized with COVID-19 compared with 54 during the previous 7 days. Someone is currently hospitalized every 3 hours in King County, and that's 8 people hospitalized every day. There are now approximately 120 confirmed COVID-19 patients in King County hospitals. Just over half of the hospitalizations in the most recent 7 days were among 40 to 69-year-olds, which is the highest weekly total among all age groups. And it's very good news that hospitalization rates are down about 70% from our summer peak. We currently have twice as many patients, however, with COVID-19 in hospitals as we had before the Delta summer surge. And despite the drop in COVID cases, hospitals throughout King County and the region continue to report extremely high patient volumes, with 98% of critical care beds currently filled. Throughout November, we averaged 2 or 3 deaths per day, and over the past 14 days, we continue to average 2 deaths per day. As I mentioned, the majority of our cases, hospitalizations, and deaths continue to be among unvaccinated residents. Over the past 30 days, residents who are not fully vaccinated were 7 times more likely to test positive for COVID-19, 39 times more likely to be hospitalized, and 39 times more likely to die due to COVID-19 related illness compared to those who are fully vaccinated after adjusting for age. Now let me turn to Omicron. We identified our first King County case of COVID-19 due to the Omicron variant on the 4th of December. Subsequently, 5 additional cases were reported on December 10th, and we were informed of 3 more just a few minutes ago by the Department of Health. These cases did not have international travel or known links to one another, and this indicates that local spread is occurring. And it's really important to understand that we don't have all the answers about Omicron currently, and a lot remains uncertain about how this variant will affect us. But we do know enough about Omicron to take it very seriously. and to take steps to decrease our risk. Here's what we do know. There's increasing evidence from other countries that Omicron is significantly more transmissible than the Delta variant. Omicron does, like Delta, spread primarily through the air in indoor spaces. The number of cases in several countries that recognized Omicron earlier than the US is doubling every 2 or 3 days. And there is an increasing number of large outbreaks being reported, including where both vaccinated and unvaccinated people became infected. And although Delta currently makes up the vast majority of cases in King County and regionally, Omicron virus spreads explosively fast, several times better than Delta. And I expect we'll see a rapid increase in Omicron cases over the coming days and weeks, at a time when we already have substantial levels of Delta variant spreading. The majority of cases that have been reported have not required hospitalization, and although it's not possible to draw conclusions about severity at this time, particularly in the unvaccinated, I remain cautiously optimistic that vaccination and perhaps prior infection are providing some degree of immunity from severe illness, particularly vaccination, because we know that even with past infection, vaccination increases both the level of immunity and the breadth against other variants. Now, based on how Omicron has behaved in other countries and studies of antibodies done in laboratories, the vaccines do lose a good bit of their effectiveness in preventing all Omicron infections. But based on experience with other variants, they're still likely to provide significant protection against serious infections. So what that means is we may see more infections. We actually expect to see more infections in vaccinated people, but most of those will not be severe. The vaccines will continue to protect us from severe infection. Omicron also evades antibody protection from past infection. This is really important. And vaccination has been recommended for people with past infection for this exact reason. It leads to better immune response against variant viruses. So even if you've had past infection, if you've not been vaccinated, it's important to do so because you're increasingly susceptible to Omicron compared to reinfection with Delta, for example. So in summary, this means we should expect to see an increasing number of breakthrough infections in vaccinated people and people who've had past infection. But vaccine will continue to work against severe infections. And for this reason, the single most important thing we can do is to get vaccinated and boosted when eligible, even if you previously had COVID-19. Preliminary data on booster doses from the UK suggests they appear to restore very good protection against infection. The most important things to know about Omicron are that it spreads through the air the same way as Delta, only a whole lot better. And that vaccines are the most important thing we can do to reduce our risk, but they must be used in combination with other strategies. This means we can reduce risk using the same layered COVID-19 precautions we use against Delta. But this virus is less forgiving, and we will need to take advantage of as many layers as we can and apply them as effectively as we can. If there's anything that we can do now to improve our COVID prevention measures at home, at work, or in the community, this is a good time to do it. Think vaccination plus booster when eligible, better quality and better fitting masks, improving indoor air ventilation and air quality, reducing the number of high-risk exposures, distancing, and layering protections. It's important to remember that risk is additive, and risk is increased with higher levels of community transmission, gathering with unvaccinated people, gathering indoors with more people and having close contact, in poorly ventilated spaces and with crowding, with loud talking, singing, shouting, and aerobic exercise. And on the other hand, risk is lower with gatherings where everyone is vaccinated or boosted, with well-ventilated spaces or the use of HEPA filtration, when gatherings are outdoors, when wearing good quality, well-fitting masks or respirators, when distancing is maintained, and when rapid testing on the day of gatherings is used as another very good strategy to lower risk. It's also important to remember that half or more of infections are spread from people before they have symptoms. So symptom screening remains important, but doesn't identify everyone who can spread COVID-19. I'm going to pivot to talk a little bit about the vaccination and booster front. In King County, among all residents, 76% have now completed the vaccination series. Thank you, thank you, thank you. 83% have received at least one dose. Among people 16 years and older, 86% have completed the vaccination series. 92% have received the first dose. And among our residents who are 65 years of age and older, we have 95% who have been fully vaccinated across all race and ethnic groups. We've administered over 500,000 booster shots or third doses in King County. We believe around 2/3 of our residents who are 65 and older have been boosted, but less than 50% of those below 65 years of age have been boosted, and that's where we are focusing our efforts currently. For the children who became recently eligible in the 5 to 11 range, we are doing really well with 28% of those children having completed the 2-dose series and 42% having received at least one dose. So clearly progress to be made there, but tremendous progress achieved as well. In our 12 to 17 and 18 to 34-year-olds, 73 to 75% have completed their vaccination series compared to greater than 87% in 35 and older. So again, the younger folks still have more room for improvement in vaccination coverage. And it's also the younger folks who are more likely to be acquiring and spreading COVID. So we can kill two birds with one stone by vaccinating more of those people as quickly as possible. Now, with respect to the boosters, with over 86% of King County residents 16 and older who having completed their primary series, most people are eligible and are seeking boosters, and these will provide additional important protection against the Omicron variant, particularly against serious infections that would result in hospitalization or death. Due to the increasing number of people who've been recommended to get boosters recently, lots of people are trying to get vaccine appointments at the same time right now. And in response, we've been increasing our vaccination capacity. We've already increased capacity and are delivering over 100,000 vaccinations per week at 18 fixed sites, pharmacies, community health centers, and primary care practice locations. And in aggregate, for our 18 fixed vaccination sites in King County, we've increased capacity by 52% in the past month. And our King County operated vaccination sites have increased capacity by 60% in the past month. Our largest site at the Auburn Mall, which sees 600 people daily, will go from operating 5 days per week to 7 days per week. But even with this significant increase in capacity, current booster demand is exceeding available appointments for same-day service. So we are continuing to increase vaccine availability throughout the county. We will be hosting a mobile community vaccination clinic program sponsored by FEMA, which is basically a vaccination clinic on wheels, and that will be stationed in Federal Way and then Auburn starting next week. It will provide over 500 vaccination appointments per day in an area of the county in need of more vaccination providers. We're also working with the Department of Health, the Washington State Department of Health, to bring other vaccine events to King County in January and February, and working closely with our nursing, physician, physician assistant, dental, and other professional associations to secure additional vaccinating volunteers. The real bottleneck here are the personnel to administer the vaccines, not the availability of vaccine doses. We're also working with nursing and other professional schools to match students to our many vaccination sites, and we are adding additional appointments every day. So here are some suggestions if you're seeking a vaccine. Understand there will be capacity to vaccinate and boost everyone who's eligible in King County, but it is important to get on a wait list as soon as possible to ensure you get your shot in the most timely way. So some waiting lists are currently only a few days, others are out a few weeks, and they vary by location and by office. If you regularly see a healthcare provider, check with their office to see if they have appointments available, and you can find and book appointments for all doses at the vaccine locator at doh.wa.gov or on our King County's vaccination webpage, kingcounty.gov/vaccine. And we're also working to expand resources to provide free self-test kits in communities that are being disproportionately impacted by COVID. And we recently began distribution to a pilot group of testing sites and public health clinics in South King County. And in the next phase, distribution will increase to include additional testing sites and other community partners, including King County libraries. We are expecting weekly deliveries of tens of thousands of free rapid antigen at-home test kits coming from the Washington State Department of Health. But we don't currently have an estimated time of arrival for these tests, but we hope they're going to be available by the end of the year. And we're working and planning with community partners to distribute these tests at key access points with particular focus on areas of the county at highest need for testing. And that also includes South and Southeast King County. Now, let's see. I think with that, I'm going to pause because I think there are probably going to be a lot of questions today to address various aspects of the COVID situation. And let's start to take a few questions now, Kate, and see how we do for time.
That sounds great. Thanks so much, Dr. Duchin. Let's get started with Jennifer Lee. And just a reminder, please let us know what your media outlet is. So Jennifer, you can go ahead.
Hello, thank you so much for taking questions. My name is Jennifer and I'm with Fox 13. So Dr. Duchin, DOH actually just let us know about some outbreaks connected to high school wrestling tournaments. And I just wanted to know how King County Public Health is responding to the outbreak and partnering with other health agencies. If you could identify some of the schools in King County that are now impacted and what the next steps might be when there's an outbreak of this size and scope. So thank you.
Yeah, thank you for your question. I know that the state did release a media advisory this morning and that Dr. Lindquist is planning to discuss the multi-county outbreak later today. We at King County Public Health identified an increase in cases associated with 4 high school wrestling tournaments on the 9th of December. And as of last night, we have been notified of 9 schools with outbreaks of 3 or more cases in their wrestling programs. And at this point, I'm not going to provide the names of the schools, but we may be able to do that shortly. But we will need to connect with them before we do that. There are additional COVID-19 cases in wrestlers that have been identified in other schools that don't yet meet the outbreak threshold. So we anticipate that there will be more than 9 schools impacted. In total, as of this moment, and we expect this to change, we're aware of 82 cases that have been associated with wrestling, and that includes wrestlers, coaches, and some family members and spectators across 20 schools that have been reported to us to date. So we have confirmed outbreak threshold of 3 or more cases in 9 schools, but we have about 20 others that have reported at least 1 case. And as of today, we're aware of at least 7 tournaments or other meets that have been associated with these cases. Of the cases where we could verify vaccine status, which is about 70 at this point, 56 have been fully vaccinated. So about 80% of these cases have been fully vaccinated. And we are only aware of 1 case that was hospitalized, but that was just an overnight hospitalization. So all of these people seem to be doing very well, which is great news. We are currently working with the Washington State Department of Health and the other affected health jurisdictions to identify multi-county tournaments that might be linked to this outbreak and to develop guidance that will be in effect across the counties for wrestling. And you'll probably hear more about that from Dr. Lindquist later this afternoon. Some of the things that our team has observed involve low compliance in some cases with masking when not actively wrestling, and low mask wearing by spectators in the bleachers. There was at least one report of a post-tournament celebration among team members that didn't have masks, and wrestlers, in some cases, attending practice or competition while symptomatic. So, basically, the COVID-19 prevention measures that we know are effective in reducing risk when we don't use them can provide opportunities for the virus to spread. And in most of the outbreaks that we investigate, we find lapses in one or another of the prevention measures that we think could be linked to facilitating transmission in those cases. So at this point, we've given the affected schools who have been in touch with us guidance on pausing wrestling practices and associated activities until all the wrestlers and staffed and exposed personnel have been tested for COVID-19, and then how to manage people who test positive or who test negative based on their vaccination status. And we anticipate that this guidance is going to evolve, and in collaboration with other local health jurisdictions in the state, there might be additional guidance provided as early as this afternoon. So that's a summary of what we know now, and we'll be happy to provide more information as we get it. This is a very active investigation.
Excellent. Thanks so much. Sally James, you can go ahead.
Thank you very much for all this information. I also just want to give you an opportunity. So some of the reporting nationally today is talking about something called a triple threat, which is, I'm sure you're familiar, the idea that our Delta high levels remain, we get new transmissible Omicron, and we have the flu operating in January. And I'm just wondering if you're willing to talk about what a bad January would look like, and how you and others are preparing for that.
Mm-hmm. Yeah, okay. I will definitely address the triple threat. I need to make sure I also mentioned, and I'm not sure if I did or not, sorry, about the wrestling tournament business, that we know that at least 3 of those cases are Omicron cases. And I'm sorry if I didn't mention that when I gave the response to the initial question. There's just a lot going on right now, and I may have skipped it, or I may have said it. So if I'm repeating myself, forgive me. But we do know that at least 3 of those cases are Omicron cases. It's not surprising that if they were Omicron, it would explain some of the rapid transmission and the widespread transmission that we're seeing. But that's only 3 out of a much larger number. So we'll wait and see what some of the other cases turn up as. And that's just for King County. I can't really speak about what other counties are seeing, and I hope Dr. Lindquist will provide more information for you on that. Now, to the triple threat, Omicron laid upon Delta, laid upon influenza. Clearly, COVID-19 is challenging us. Delta was challenging enough, and I was beginning to feel quite hopeful when our summertime Delta surge finally started to wane and the numbers were coming down. We are not where we were before the Delta surge the summer surge took off, and we're now seeing the introduction of a new virus. Now, there is a potential for Omicron both to cause less severe illness and to simultaneously lead to more people needing hospitalization, and that's because even with a virus that's making proportionally fewer people severely ill, when it moves really quickly and makes many people ill in a short time frame, a large number can still become seriously ill and require hospitalization, even though any individual's risk is still lower. I do feel somewhat reassured in the context of the triple threat by the relatively high level of vaccination we have here in King County, and I encourage people to keep it up, because that is our single most important defense against Omicron. against Delta plus Omicron, and we have flu vaccines that can protect against influenza. So vaccination uptake is critical, and we've done relatively well. I'm very grateful to the people of King County who've been vaccinated to protect themselves and others around them to help keep our healthcare system available for those who need it. And I think that will serve us well in the context of a potential triple threat. However, even a double threat of Omicron plus Delta, or even Omicron alone, give or take influenza in either of those scenarios, could pose a significant challenge to our community and to our healthcare system. And we've certainly alerted our healthcare partners early on about this potential threat. And I know that our partners in the hospital system at the Northwest Healthcare Response Network are actively planning, and I encourage you to reach out to them to hear details about some of the things that they're planning. But we really do need to be prepared for a potential surge in cases again. And it's not something that we were expecting or that we're very happy about. I think in the context of preparation, our community has an important role to play here, because if we can decrease the number of people who become infected, we can decrease the risk of a need for a very unprecedented surge in our healthcare system that could compromise the type of care that we all want to get and that we need to get when we have serious illnesses. So taking the steps that we know work to prevent COVID transmission will become increasingly important over the coming weeks. And I anticipate, again, somewhat optimistically, I hope that by springtime, we'll have weathered this storm, but it is going to take some added effort, both at the healthcare system level and at the community level, to minimize the risk to all of us.
Thank you. Let's take a question from Anna Boyko-Wyrak. You can go ahead.
Thanks so much, Anna Boyko-Wyrak, KUOW Public Radio. Long time no see at one of these press conferences. Jeff, so, it's hard to know just how scared to be anymore. And a lot of my audience, they've been working really hard to be safe over the past 2 years. So let's say I'm vaxxed, I'm boosted, I keep my mask on. Should I interpret Omicron as a red light, a yellow light, or a green light as far as my safety goes?
Yeah, thank you. It does, all this news is scary. There's no doubt about it. I mean, it's been a long, difficult 2 years, and Delta was very challenging. And now when we're just sort of thinking we get around the corner and over the hump with Delta, virus gets smart again. I think that people who are up to date on their vaccinations with the booster should feel yellow light about this. It is a new, unanticipated challenge. But if you're vaccinated, you're still protected against what really matters. You're protected against serious disease. We set a really high bar for these vaccines early on, hoping that they would be 90 plus protective against any type of infection. But that was probably unrealistic, and none of our vaccines against respiratory viruses completely shut down infection. We are really most interested, realistically speaking, in the ability of a vaccine to prevent someone from getting sick enough to have to seek medical care or be hospitalized or die. This is what the vaccines do best. And for people who are up to date on their vaccinations, they have good protection. But we do need to expect, and I think everyone should be prepared for eventually many of us being infected. Now, being infected doesn't mean getting seriously ill, but it's a fact that the vaccines are less effective against infection, particularly less severe infection with Omicron than they were against Delta. So more of us will become infected, and we're seeing many outbreak reports now where large numbers of people who went to gatherings and parties became infected with Omicron. The vast majority do very well. I haven't seen any reports of hospitalizations yet in those outbreak reports. These are mostly vaccinated people. So the real risk remains to the unvaccinated. But I think we do probably need to readjust our expectations a little. You know, I mentioned in an earlier conference, one of my favorite authors, Norton Jester, had a saying in the Phantom Toll Booth that expectations is the place you have to get before you get where you're going. And we had very high expectations for the virus, for where we were at in the context of this pandemic, that I think we just need to readjust to reality. If you're vaccinated, if you're taking precautions to reduce your risk, you should feel cautious. But you should feel optimistic and reassured that you have a very strong level of protection. You're not invincible. You can still become infected. You can still pass the infection to someone who's vulnerable. It's important to remember. But over time, more of us will be vaccinated, and through exposure to the virus, will develop additional protection that will lead us out of this cycle of vaccination surge and fear. So I think it's a yellow light scenario for those who are covered with vaccination and to take other precautions, including wearing good masks and avoiding some of the high risk environments. It's a very different situation for those who are unvaccinated, who remain at very high risk for severe health outcomes.
And sorry, just to follow up, I mean, people run yellow lights all the time. So if I'm going to get infected anyways, and if I'm vaxxed, and I'll probably do fine, like might as well stay calm and keep my mask on and just go party, right?
Well, I agree with 2 out of 3. I agree with stay calm and keep the mask on. The issue around the just go party thing is that with Omicron now beginning to take hold here and probably will be surging over the next couple of weeks, having so many people get sick in such a short time really can be a problem for our healthcare system. As I said, the individual's risk doesn't change, but when you have so many people getting infected in such a short time, that's a problem, particularly a problem for a healthcare system, but can also be a problem for businesses and others who rely on, having a certain number of people doing their jobs on a given day. So I think it's really important for us to continue to do whatever we can do to slow the spread and to blunt this Omicron surge so that we don't overwhelm our hospitals, and so that they're there for us when we need them. I do think that we will get through this surge, and then people will be able to, to party as well, and as long as they would like to. But I think this is particularly bad timing to abandon your precautions around gatherings.
Thank you, Jeff. Let's go to Tony B. You can go ahead. Let's see, we might just be having a little issue.
Okay, I think I was muted.
Okay, great.
This is Tony from Rainier Avenue Radio. Dr. Duchin, how are you?
Hello, Tony. How are you? I'm doing well.
Under the circumstances, I'm fantastic. The J&J was very available in South Seattle, our community. And information that I'm aware of is that the vaccine wanes after a couple of months. And so my question is, in regards to the health of the community, has there been any type of outreach to make sure that the community knows that they may not be, their vaccine resistance may not be as strong? And do you have information that shows that those who were vaccinated by J&J in the community, was there an uptick? My concern is that folks may be thinking that they're vaccinated, and this waned after 2 months.
Yeah, that's a great question. Thank you. I think it's important both for J&J vaccination recipients as well as others who may think they're fully vaccinated if they haven't gotten their booster. So J&J is a different vaccine technology. It produced lower levels of what we call neutralizing antibodies that waned. and were associated with more cases of breakthrough infection. Although it still did provide very good protection against severe disease, people who got J&J, just like people who got the mRNA vaccines, were recommended to get a booster. So if you had one dose of J&J, you're recommended to get another dose of a vaccine. And that could be a J&J or it could be one of the mRNA vaccines. And we have been, because of the risk of the blood clotting disorder, the rare but very occasionally severe blood clotting disorder, thrombosis or thrombocytopenia syndrome and central venous sinus thrombosis in women, particularly younger women. We've been mostly offering and trying to steer people towards the mRNA vaccines for their booster doses or subsequent doses. But the J&J still is available if people insist on it. And the message really has been for everyone, whether you received a J&J vaccine or an mRNA vaccine, that you should be getting a booster dose, when you're eligible. So if you think that message has not gotten through, Tony, to certain communities, please loop back with our comms team and we will enhance our outreach. We've tried to do a lot of outreach throughout the county and had a lot of in-person venues and other sort of town hall things to get this word out. But I would not be surprised if there are people who still haven't heard it. So if you have received one dose of J&J vaccine, you do need a booster dose. You can get a booster dose of the mRNA vaccines. It's perfectly acceptable for anyone to get a booster dose using a different vaccine than they receive for their primary series. But at minimum, we want everyone who's eligible to have that second dose in for J&J and that third dose of the booster if they started with an mRNA vaccine.
My follow-up question, thank you. My follow-up question would be, do you have information geographically that answers the question if folks who've received the J&J have gotten an additional booster, or do we not have that information?
We do have the information about the number of doses people have gotten after their primary series. I don't have it handy, but we can provide that. I can tell you that in general, I think I might have mentioned earlier about 2/3 of our residents who are 65 and older have been boosted. And the vast majority of people in the county who've been vaccinated have received the mRNA vaccine. So only a small proportion of primary vaccine series were the J&J. I don't have the breakdown handy, but we can get that to you.
Thank you.
Great, thanks so much. And we'll put in the Facebook chat and also here a link to some of the outreach materials that may be helpful about the booster shot, including some flyers. So we'll get that up for you as well. Thanks for raising the point. We'll get back to some of the media questions, but I'm going to consolidate a few questions that are coming in from our community as well as Maher Grual that's trying to get at, in different ways, trying to get at the concept, Dr. Duchin, about younger kids who aren't eligible for the booster and how can we protect them given Omicron. So much of the messaging that we've heard is that a booster is so important to really protect us around Omicron, but we know younger kids aren't eligible for boosters at this point. So any thoughts around that? How should we be thinking about protecting kids given that?
Yeah, so I guess this is a question about the 5 to 11-year-olds. And
that's right.
So there's two things to consider. One is, one reason we need boosters is because those very high levels of antibodies that are achieved shortly after vaccination slowly decrease over time. It's not an abrupt drop, but it's a slow decrease. And so for the 5 to 11-year-olds who are just now completing their series, they would be expected to have relatively high levels of antibodies and protection for the coming months. There are no real widely available data that I'm aware of that look at the booster situation. So, in that group, because they've just so recently been recommended to receive the primary series. But I do anticipate that will become an area of concern and investigation as we can track over time what happens with these young children who are just starting to get vaccinated. So it's very early, but we may see at some point in the coming weeks or months a recommendation for a booster dose in that group. I would not be surprised, but it's just a question of timing. Earlier on, there's less need for a booster. Omicron may change that somewhat. It's not clear, but we know that the younger people are starting out at lower risk for serious illness in the first place. Secondly, they're recently vaccinated, so would have higher levels of protection. And over time, we will, I hope, figure out what the optimal time is to boost that young group if it turns out that it's necessary.
That's really helpful. Let's go to Mo Hader. You can go ahead.
Hey, Dr. Dushin, good morning.
Good morning.
All right, just to make sure you can hear me. Thank you for doing this. With this, you said with the expected wave of more cases, do you think the current county mandate needs to be modified to strengthen and make it more strict? And if so, how? And a follow-up question, do you feel the fully vaccinated definition needs to be changed to include boosters?
Yeah, two good questions. When you talk about additional, mandates or additional recommendations, we hear about other cities across the country, other states that are adding on things that we're already doing, basically. So other jurisdictions are now requiring masking indoors, which we already require. We have also worker vaccination requirements that many other jurisdictions don't, for the state and local government, for healthcare workers and for teachers. And we have our vaccine verification plan here in King County and in Clallam County currently. I don't know how many other counties may be considering it in Washington State, but we do have a number of measures already in place that other jurisdictions don't, that they are now adding on to help protect against the Omicron surge that's anticipated. So at this point, we are not considering adding any additional measures, but I think it's always an open question. I mean, we would have to be able to come up with a proposal that is both realistic and that we think would make a difference. And I think we were just fortunate that we had the foresight to have in place already some of the types of measures that other jurisdictions are now adding on. And I think for us, it's just a question of trying to comply more comprehensively, use more of the measures that are both mandated and recommended to help decrease the risk. I think people understand, how this virus spreads through the air now. They understand what strategies we have to reduce the risk. We have a lot of requirements, and I think we also have to rely on people voluntarily complying with both the requirements and the recommendations. And I think at this point, we can do really well with voluntary compliance. So that's where we're at with respect to considering any additional mandates at the moment. But, as I said, Omicron and Delta and COVID in general is a bit unpredictable. So we will continue to reassess the need for any potential additional measures. But at this point, I think we're going to try and do a little bit maybe better with the current guidance and again, particularly our vaccination coverage rates are the most important. So getting people vaccinated has been our priority from the get-go, and we've done really well. We have a high proportion of people vaccinated. Clearly, every additional person that gets vaccinated helps not only protect themselves, but also protect those around them. And we are very gratified by the number of people who are continuing to seek vaccination. And I'm not sure that additional mandates at this point, are necessary to move us in the right direction, or could move us any further, any faster in the right direction.
Thank you.
And just to follow up,
Sure.
do you think fully vaccinated should be, and the definition should be changed to include booster shots?
Sorry, I forgot to answer that question. I think for practical purposes, that is what we're using for the definition of fully vaccinated, in the sense that we're, at the national level, recommending that everyone that received 2 mRNA vaccines or 1 Johnson & Johnson be boosted. Now, some of those, for most people, the recommendation is you should be boosted, and for some, it's you can be. That's a nuance that's perhaps less helpful or important at the local level, where we're encouraging everyone who's eligible to be fully vaccinated. I do think ultimately, yes, we should, as a nation, come to a common understanding of what fully vaccinated is and what that criteria would be for different people, different age groups in particular, and different risk populations. But I think, as a just practical rule of thumb, we are considering people to be fully vaccinated, or we are desiring people to get their booster dose to receive the full benefit of vaccination when they're eligible.
Thank you.
Thank you, Mo. Liz Brazil, you can go ahead.
Hi, Dr. Dushin. Liz Brazil, also with KUOW Public Radio here. And I'm wondering, at this point, obviously vaccine mandates have been successful for the most part, but there are still people who haven't been vaccinated. I'm just wondering what kind of strategies public health is employing at this point to reach those King County residents who remain unvaccinated. And also, I'm wondering, can you kind of loosely quantify how many of those people appear to be vaccine hesitant versus flat out just against getting vaccinated at all? And kind of what some of the reasons you're hearing for that are at this point?
Yeah, thank you. Really important question. There's been just a very tragic amount of intentional anti-vaccine disinformation that has flooded the internet and various media channels that has confused a lot of people. We know that some are not being vaccinated because they believe things that aren't true about the vaccine, that it's unsafe, or have misunderstanding about how it was developed. And then there are others who feel perhaps that it doesn't comply with their political ideology, which is also quite sad, because this is a personal and public health issue, not a political issue. And then there are people who just have remaining concerns, who understand the accurate information, but still have remaining concerns, fear of needles, and so on. We don't have local data on the proportion of hesitant people, unvaccinated, that might fall into each of those categories. There have been a number of national studies, but our bottom line is the door is always open. We understand that people sometimes are influenced by information that is inaccurate, or by others who don't have their best interests in mind. We understand that nobody wants intentionally to become sick, to end up in the hospital or die. And we understand that some people have concerns that haven't been adequately addressed. And so trying to provide accurate information in as many venues as possible, reaching out to community. We've got teams that are community-based teams working with partners to try and understand how we can reach hesitant people in their communities within King County, doing in-person and virtual town halls to answer questions, and trying to direct people to reliable sources of information. I think all of us, the vast majority of people in King County have been vaccinated. And I think, we all have a role to play if we know those who are unvaccinated, and trying to to help them understand the benefits of vaccination and to talk to our family members, friends, and loved ones. But there are some people who, ultimately will not be vaccinated. And I don't think we're ever going to have everyone, decide to be vaccinated. But, we will do whatever we can to help people make the best decision to keep themselves healthy, to keep their family members healthy, to protect our healthcare system, and to keep our community as a whole healthy. And I feel very gratified by the good sense that, the vast majority of our King County residents have shown in coming forth and being vaccinated. And we will continue to try and identify ways to provide that opportunity also to those who have not yet been vaccinated.
Great, thanks. And I know we're getting to time here, and I want to give you a few minutes to wrap up, Dr. Duchin. But just one last question about Omicron to put it in context for our local community. We are getting a lot of questions about the numbers of Omicron cases here in King County. I imagine those numbers are changing rapidly as more surveillance is going on. So I was just wondering if you could comment, one, about whether there are any different prevention measures that folks should be taking. And just two, as our local health department, how we're looking at the Omicron cases. Are we moving more towards looking at larger surveillance as opposed to individual cases? Any thoughts from you, just how our local health department is going to start to look at this?
Yeah, sure. I'll address the part about how to think about it in my closing comments. But with respect to the surveillance piece, these viruses that infect people and then are identified through testing, PCR testing, when they go to seek a diagnosis or test, are done at different laboratories throughout the county. And a sample of those tests are then forwarded on for testing to see if they're what variant they are. So not every case gets tested. So basically, we're doing a sample to see whether it's out there and what proportion of cases the different variants represent among all those that are sampled. So we can't really count the number of Omicron cases, just like we couldn't count the number of Delta cases when it emerged. What we could do is track the proportion of all cases that are being sent to these laboratories that do the sequencing that identifies the variant that belong to the different variant strains. So what we will see over time, and what we can report on through the state health department, who manages this system, the sequencing system, is how the number of Omicron viruses compares to the number of Delta or other variants that are being identified. But the number of cases in the community is much higher than the number that we detect through the sampling. So I think we can assume that Omicron is fairly prevalent right now, although still at relatively low levels compared to Delta, which comprises the vast majority of COVID or SARS-CoV-2 viruses that are causing COVID-19. But it will, based on what it's done everywhere else, we expect it will increase very rapidly. And you'll see in the surveillance reports, the sequencing variant strain surveillance reports that come out, more and more Omicron, and hopefully fewer and fewer Delta over time. So that's how we will respond and communicate about the variants, very similar to the way we did with Delta when it was first introduced. But again, people can't expect to know with their own individual case necessarily whether it's due to Omicron or Delta, and that is not a problem because the steps you take are exactly the same. Whether it's Omicron or Delta, both with respect to prevention and with respect to what you might need to do after you're diagnosed.
Thank you very much. And then any closing comments for you?
Yeah, thanks everyone. I know this is a lot. It's definitely a lot more than I was looking forward to saying. I really wanted to wish everyone, and I will wish everyone, a very peaceful and healthy holiday season and a much, much better new year going forward. But I know there's been more that I've had to communicate than just my season's greetings to you. And I just want to repeat a few of what I think are the key points from today. Although the Delta variant is currently causing the majority of COVID-19 cases locally, Omicron is clearly beginning to spread rapidly, and we need to take a concern about the surge in COVID-19 cases seriously. Even if most people don't require hospitalization, and clearly most vaccinated people will not, when a very many people are infected in a short time frame, even a relatively small proportion of seriously ill can rapidly add up to be a large number. And our healthcare system does not have a lot of surge capacity at the moment. So once again, we need to look out not only for ourselves, but for one another to decrease COVID-19 illnesses and to preserve our limited healthcare capacity for those who need it, not only for COVID-19, but for treatments of heart attacks, strokes, accidents, cancer, trauma, and other urgent medical problems. So for the public, for all of us, the key is to get vaccinated and boosted when eligible. Wear a high-quality, well-fitting face mask. Avoid poorly ventilated and crowded indoor spaces. Isolate and get tested if you have symptoms or are exposed to someone with COVID-19. And it's also a good time to get a flu vaccine. At this time, flu is picking up nationally. There have been a number of reports from around the country. Activity is still low here. So to avoid that triple threat scenario, getting your flu vaccine can help as well. The emergence of Omicron is a disappointing setback and where we had hoped to be 2 years into this pandemic. The virus clearly does not care about our hopes or expectations. Despite this, we're not going back to square one of the pandemic. We have effective vaccines to prevent serious illness, and we know what works to prevent COVID-19 spread in the community. And over time, I'm confident that increasing immunity from vaccination and for some exposure to the virus will make COVID-19 less and less of a threat. But for now, we should expect more Omicron cases over the coming days and weeks and take whatever extra precautions we can to reduce the risk both to individuals and to our community. Thank you again for joining us today. And I wish you all a peaceful and healthy new year.
Thank you very much. Have a good afternoon.